The penis has an internal root that goes into the body cavity and a visible shaft, and then the very superficial piece of it, the glands. The prepuce is basically a fancy name for foreskin, and it's the loose skin on the shaft that allows for expansion in erection. It's also very densely innervated with tactile corpuscles that sense light touch. There is something called the frenulum, and it's a little tiny piece of internal connective tissue, and it anchors and secures the prepuce to the glands. Circumcision removes the prepuce. In cross-sectional images of the penis, you can see distinct cylindrical structures. There are two called the corpora, which is the plural for body, the corpora cavernosa, and then there is one corpus spongiosum, right there. They all fill with blood during an erection. The urethra runs through the corpus spongiosum. That's like the little, it's like a smiling mouth right in the middle of there. Runs through the middle of the corpus spongiosum, and it serves as the final passageway for both urine and semen. And it ends with the external urethral orifice at the tip of the glands. All of these corpora, all of these erectile bodies, they have their own wrapping called the tunica albuginea, which is not anything having to do with the tunica albuginea of the testis. We just give it that name because it's a white connective tissue covering. The corpora cavernosa are separated by some connective tissue septum right at the center of them. But at the very center of each of the corpora cavernosa is an artery. Right there and right there. The cavernous spaces in the erectile tissue are formed of trabeculae, which is basically an arch-like structure, and these are created of smooth muscle, and they create these open spaces that blood will fill during an erection. Each corpora cavernosa has a deep artery supplying the blood during erection. On the dorsal surface of the penis are also arteries that serve the skin and other connective tissues of the penis. And I guess that we should talk about which side of the penis is actually dorsal. In the anatomical position, the penis is held erect. So therefore, when erect, these arteries along the dorsal side are on the side facing the body. The dorsal artery splits to serve the corpus spongiosum, which the deep artery serves the corpora cavernosa. There are parasympathetic fibers that are release norepinephrine, and this causes these arteries to vasodilate. And so that trabecular smooth muscle of the erectile tissues, it starts to relax, and blood engorges the open spaces. The bulbourethral glands also start to secrete a pre-ejaculate fluid, and heart rate, respiratory rate, and blood pressure all increase as a result of this parasympathetic activity. Ejaculation is a sympathetic controlled event. At first, peristalsis in the vas deferens allows the prostate and the seminal vesicle, those two accessory organs, to add their secretions to the passing spermatozoa and semen. Upon expulsion, the entire urethral sphincter constricts to prevent urine from entering into the urethra and semen.